you've likely heard of hyperbaric oxygen therapy. Powerful intervention, and it's really a form of oxidative stress because you infuse all this oxygen, which we consider a vital nutrient that your body needs, and frequently is, in many cases, unable to get for whatever reason, sometimes a local injury. So I am going to go deep into someone who's actually getting a PhD in hyperbaric oxygen therapy, and we're going to enlighten you about so many reasons why you might want to consider this for a wide variety of indications.
We only think about it traditionally to help save the life or limb of somebody in a really severe condition, but the mechanisms that are working for those folks are very similar to the reasons that you and I might consider using hyperbaric oxygen for upregulating the oxygen levels inside somebody's body, which will help reduce the inflammation that many people are exposed to, increase mitochondrial function that many people have issues with, and thereby increasing the energy that those cells are able to generate. My thought process is the mechanisms of action of hyperbaric are the same, whether we're talking about gangrene and radiation burns and osteonecrosis, as they are for TBI and concussion, maybe MS or post-stroke, so many of these other conditions that we might be using hyperbaric for. And if we really get a mastery of the mechanisms of action, we can start to apply those mechanisms across the board to understand, clinically, we've seen hyperbaric work for so many of these other chronic illnesses. If we could really hone in on those mechanisms and understand them better, and then get a better feeling for what point of time and what pressure settings do we require in order to get those mechanisms to start kicking in, then we can really, with more confidence, apply this therapy to these other conditions and have more consistent results in doing so.
Welcome, everyone. Dr. Mercola helping you take control of your health. And I have a repeat guest with us today, Dr. Jason Saunders, who is the clinician who first introduced me to hyperbaric oxygen therapy. And I've had a chamber for a number of years now. How many years did we first connect, Jason?
I was just thinking that. I think it's a little over 2 years.
No, it's got to be 3. It's got to be at least 3, maybe even closer to 4. So I've been through. Time flies when you're having fun. So interestingly, this is his passion, it's his life. His formal training is that of a chiropractor, but he's going back, and this is why we're doing a follow-up, and he's actually getting a PhD in hyperbaric oxygen therapy. So he's going to give us some great updates. So today we're going to talk about, obviously, hyperbaric medicine. And I think the best question to start out with for those who have not been exposed to it in the past is, what do you think its benefits are, and what can it be targeted for? And maybe comment a little bit on its use in the use of infectious diseases. And then we can talk about how it's administered and how one can find access to it.
Okay. Yeah, I mean, there's a lot in that question. So I'll start piece by piece. But what I would say is this, every cell in our body requires oxygen to create energy. All the cells except for our red blood cells, basically. So our red blood cells are charged with the job of delivering oxygen to all the other cells, who utilizes that oxygen for the creation of energy within that cell. A lot of many chronic illnesses or many issues that people are experiencing in general in America or other industrialized nations has a lot to do with decreased mitochondrial function, increased systemic inflammation, and a lack of the ability for cells to really generate the amount of energy that they need to perform healthy and optimally in whatever function that they have. And so, we use hyperbaric oxygen traditionally for these, terrible and severe conditions. And we often use it as a last result for, literally right before an amputation surgery, or potentially, as a life-saving mechanism for somebody with carbon monoxide poisoning or air gas embolism. So, we only think about it traditionally to help save the life or limb of somebody in a really severe condition. But the mechanisms that are working for those folks are very similar to the reasons that you and I might consider using hyperbaric oxygen for upregulating the oxygen levels inside somebody's body, which will help reduce the inflammation that many people are exposed to, increase mitochondrial function that many people have issues with, and thereby increasing the energy that those cells are able to generate so that we can start to see a much more healthy, vibrant human as each of their different cell types are starting to able to generate the energy that they need to function properly.
Yeah. So why don't you give us an update of your journey since we last talked, and what's been happening, and what motivated you to get back to school and continue your studies in this discipline?
Yeah. So I think last time we connected, I think I had just finished, writing Oxygen Under Pressure. Mm-hmm. And, that was a great experience. You've written quite a few books. So it was a big journey for me, but it was well received and we did pretty well there. And at that point, we were, seeing a great uptick in interest and the awareness of hyperbaric. And, we were participating in a handful of different either interviews or summits or even, online or in-person conferences, and, having a good opportunity to share so much of the information of hyperbaric with other doctors, with the public. And as that continues to grow, there was, as you well know this, I mean, when I first started, I think about 14 years ago, the amount of research that was available in hyperbaric was, negligible. At this point, it's grown a lot, but there's still enormous holes in the research. And, so many people asking so many of the same questions, things like, what pressure is required to get the benefits that I'm looking for? How many sessions are required to get the benefits that I'm looking for? And, at this time, the real answer to that is still, I don't know. Mm-hmm. We know certain ranges, we know certain periods of time, but we really don't know that level of detail. And so honestly, just being frustrated by, reading as much as I've read and learning as much as I've learned and still not having those answers. And then also really generated through some conversations between you and I decided that, if we were going to get those answers, someone's going to have to do the work. And so I decided that I should contribute to that process. So I applied to University of Miami, so their PhD program in molecular biology. And then my focus is in specifically regenerative medicine. And I'm using hyperbaric as our tool for the research that we're going to be doing to really help understand the different pressure ranges and ultimately what effect those different pressure ranges have, and to be a little bit more, or hopefully a lot more specific in terms of what our expectations should be, what types of changes happen over what periods of time based on those different pressures, and hope to at least be able to contribute significantly to answering a lot of those questions. So that was sort of the impetus to going to school. Now, school was supposed to be a mix of in-person and online learning. And, I started in the fall right before COVID. So my first semester was that sort of hybrid. And then we, like most other universities, we ended up going fully virtual for most of the following year. Classes are a great experience. It's different going back to school from this perspective, especially at this level. But there's so much to be gained, so much knowledge to be learned. And, I'm looking forward to being able to apply, so much of this biology and genetics and epigenetics into the field of hyperbaric medicine and contribute my part to that.
So how does the study or the curriculum work? Is there a basic amount of courses that you need to take and get under your belt and then write your thesis? And have you selected your thesis and started on it?
There's an amount of base knowledge education in mastery in biochemistry and basic molecular biology, basic genetics. Then there's a course load that you get to choose from, that help really a little bit more in depth with exactly what your topics are going to be. So I'm about 2/3 of the way through the academic component. Mm-hmm. Once you're about halfway, you're allowed to, apply for candidacy and start with your thesis. So I did write the thesis. I did have, I went through that whole process. That was approved. And then I just spent the last few months writing the informed consent and the IRB. And so that the research itself has actually been approved as of literally about a week ago.
Well, congratulations. Maybe you can share with us what you're going to do your thesis on.
Yeah, so there's been some great increases in, like I said, awareness and research in the field of regenerative medicine with hyperbarics. Specifically, I know you're aware of the guys out of Israel that are doing a lot of that work. And so I really want to expand on that because I believe while we use hyperbaric for traditionally in traditional medicine, we use hyperbaric for these basically life-threatening or limb-threatening diseases. And so when somebody's next step is, likely to be an amputation of a limb or potentially death from an infection, that's when hyperbaric is often introduced. And even in those dire circumstances, we seem to have great response with hyperbaric for those patients. And so that being said, we've still been so slow in traditionally to uptake more hyperbaric oxygen as opposed to these really acute and severe conditions for these other sort of chronic autoimmune neurodegenerative conditions. But my thought process is the mechanisms of action of hyperbaric are the same, whether we're talking about gangrene and radiation burns and osteonecrosis, as they are for TBI and concussion, maybe MS or post-stroke, so many of these other conditions that we might be using hyperbaric for. And if we really get a mastery of the mechanisms of action, we can start to apply those mechanisms across the board to understand, clinically, we've seen hyperbaric work for so many of these other chronic illnesses. It's just that we don't have the level of research at this time to really support it the way we do, some of the more severe conditions. So if we could really hone in on those mechanisms and understand them better, and then get a better feeling for what point of time and what pressure settings do we require in order to get those mechanisms to start kicking in, then we can really, with more confidence, apply this therapy to these other conditions and have more consistent results in doing so. And so a lot of the work that I'm proposing to do is tagging on to some of this work in regenerative medicine where they were looking at, in some cases, a lot of the, the collagen and fibroblast and stem cell response to hyperbaric. And then in a newer study that came out, I think it was actually in 2020 on the telomeres, and looking at, this potential, upwards of 20% increase in telomere length especially in certain immune system cells. I want to build on that knowledge base. And so what I'm doing is I'm creating a study that's going to have a lower pressure group and a higher pressure group. And we're going to be looking at, a whole cytokine panel so we can get to understand the mechanisms of the anti-inflammatory side. We're going to have a methylation panel so that we could start looking at the epigenetic effects of hyperbaric. We're going to have a telomere component similar to the telomere study that was done a year and a half ago.
That was out of Israel, right? Out of Israel.
Yes, exactly. And we're going to start comparing, all of those metrics across roughly a 3 to 6 month time frame of treatment, and over 2 separate pressure settings to better understand which pressures are getting which effects. And again, what period of time should we be expecting before we get the results that we're looking for.
Yeah. What pressures did you select?
So I selected on the low end, I selected the 1.3, 100%. Both are going to be 100% oxygen just to keep that consistent. But as you well know.
And you're breathing that through a mask. It's not 100% in the chamber,
right? Correct. Yeah. Most likely in the setup that we're going to do, we're going to use hoods just to increase the likelihood of getting a full 100% dose. But, you know that soft chambers are basically running at 1.3, and there's a lot of soft chamber use across the country. And there's a lot of.
When you say 1.3, for those who don't know, that's atmospheres.
Yes, the 1.3 atmospheres. In PSI, that's about 4.2 PSI. And we're going to run that against higher pressure, so 2.0, 2 atmospheres, which is basically, 14.7 PSI. And a lot of this is because, listen, if soft chambers are effective and they work well, we need to be able to measure that and determine where they fit in this concept around hyperbarics.
Yeah.
And
would make it more widely available for sure.
Exactly. And if they don't, in other words, if across the board we're talking about therapies and we're not comparing apples to apples in any way, shape, or form, then we need to know that too, and we need to start being as specific as we can with exactly what the expectation should be when we're using different pressures of different equipment.
Now, I suspect you've done a literature search and review before you submitted your thesis, and has there been any serious or significant studies done on the soft shell or soft chambers?
Yes and no. There's nowhere near the amount of research in soft chambers as there are in hard chambers. The overwhelming majority of research is done at that 2 atmosphere range, which is why I'm choosing that as the upper end of the research that I'm doing. In the soft chamber research, there is definitely there's some on sports recovery. There's actually some ongoing studies right now on hyperbarics for stem cell use that we're waiting for some of that published work to come out. In some cases, 1.3, as opposed to being used as a treatment arm in the research, 1.3 has been used as the sham group in the research. And, whatever the reasons for using it that way, maybe because the study team really thought that 1.3 wasn't going to have an effect and it's a legitimate sham, or potentially that we're trying to negate the use of 1.3 within the field. I'm not sure, but there are some great studies. There's a study that was done on cerebral palsy, and 1.3 was used as the sham group. And with a lot of people, this as well as anybody else. It's not that difficult to look up a study. You might read the abstract, you might read the results, and you kind of move on from there. Very few people really start picking apart the studies themselves to really understand the design and what went into it, and how valid are the results that we're really concluding. So in this particular study, at 1.3 as being the sham group, there was a baseline test. There was a control group that got no hyperbaric at all, and then within the sham group, there was significant improvement on the metrics that they were measuring. And then they had a 1.5 100% oxygen, which also had a good improvement. And then a 1.75 100% oxygen, which had even a greater improvement. The issue in the study was that while all 3 of those groups improved, there was no statistical difference, or enough of a statistical difference, between the 1.3, the 1.5, and the 1.75. And so the conclusion of the study was, therefore, hyperbaric does not work for CP. Although all 3 of those groups had, significant improvement. And so because the sham group was not considered a treatment, that was the conclusion of that study. Now, the natural consequence of that should have been potentially redoing the study and creating a different level of what the sham should be, obviously, and what the treatment arms ought to be. But that was never redone. And so as a result, there's this study that the results say, hyperbaric does not work for CP. Meanwhile, clearly what it means is we need more studies. It's just, as you well also know, studies are expensive. They're very time consuming, and you really have to have, a large interest in trying to come up with the right answers to really put forth the effort and time and money to get that kind of work done. Sure.
So let's get into the mechanisms of action, because I find that intriguing. The general thought is that it seems to be relatively obvious, is that if you breathing 100% or exposed in an environment of 100% oxygen, and you put that under pressure, you're going to deliver simply more oxygen to the tissues. So that's clearly a part, but that may not be the biggest reason why the benefit occurs. And the last time I reviewed this, it's been a while now, I thought there was some speculation as to the generation of a molecule called HIF-1 alpha, hypoxic inducible factor alpha, that is generated when you actually lower the pressure. So that seems that maybe much of the benefit occurs once you are getting out of the chamber and you reduce that, because that catalyzes the generation of this molecule. So can you comment on that and give us your thoughts?
So, a lot of the work, I think, over the last year and a half for me, in terms of what I'm reading, but also what I've been teaching in a lot of the courses that I teach is exactly that. I would say we don't have an exact number right now, but I might say something like, roughly about half of the treatment is occurring while you're in the chamber, being exposed to the pressure, being exposed to the oxygen, and literally accumulating a surplus of oxygen because of the therapy itself. And then the other half of the therapy is when you get out of the chamber, that oxygen can no longer stay in solution. So it literally starts trying to, bubble out of solution. But as that happens, it's not inert, it's actually very active. And so as it's coming out of solution, it's interacting with all of our cells. And as a result, it's triggering a massive cascade of events, cellular communication that seems to stimulate multiple series of regeneration and anti-inflammatory and even within the reactive oxygen species themselves. So when we look at the first part, which is the dosage of oxygen a person is getting, which is really what hyperbaric medicine has been focused on for the last, however, depending on how long you want to go back in history. And that's measurable. You could say, here's a person, they were in a chamber, they were at this pressure, breathing this percentage of oxygen for this amount of time. And you could literally calculate the theoretical dose of oxygen that person was exposed to and should have been able to absorb. And we've kind of just stayed in that mindset for all these years. And there was a great paper, the same group out of Israel. And they wrote this paper. It was called the Hypoxia-hyperoxia paradox. And what they're saying is, we know that there's amazing benefits of hypoxia, actually. And when you go into these states of hypoxia, to your point, HIF-1 alpha is stimulated. And there's this entire cascade of cellular events that start to stimulate the stem cell responses, the collagen responses, the angiogenic responses. So one of the biggest, I would consider hyperbaric to be this anabolic therapy. It's a therapy that stimulates growth and repair. And so VEGF, BDNF, PDNF, all of these growth factors are stimulated from hyperbaric, but they're not stimulated from the hyperoxygenation. They're stimulated from the process that your body's going through as that oxygen is leaving your body, this hypoxic component. But it's not true hypoxia, it's relative hypoxia. And that's the important thing to note, is that once you've accumulated all this extra oxygen, your hyperoxygenation component, as that oxygen is leaving your body, you're never truly hypoxic. It's just you're losing the extra oxygen that you just gained. But the cell signaling factors that respond to traditional hypoxia are also seemingly responding to this relative hypoxia. And if you look at that paper, which is a great paper, it seemed to delineate this. With hypoxia alone, you will still get VEGF, which means you'll still get a lot of angiogenic, so the rebuilding of the endothelial lining, the creation of a new microcirculation bed, all this capillary regrowth will happen from hypoxia. You'll get these stem cell releases, so this potential for increase in regenerative nature of cells. You'll get this increase in the HIF-1 alpha, as we were discussing. But if you're chronically hypoxic, you're also going to get a down regulation of sirtuins, and you're going to get a down regulation of mitochondrial function. And sirtuins could play a great role in things like, cell cycle life, getting cells out of cellular senescence, or kicking them back into active life, or literally apoptosis, killing that cell so that we can replace it with a new stem cell. So sirtuin, or even the genetic and epigenetic repair mechanisms, a lot of that has to do with sirtuins. So we don't want to downregulate those. We want to upregulate those.
This hypoxic induced sirtuin inhibition, and sirtuins, by the way, are longevity proteins for those who don't know. Very important to health and longevity. But are you suggesting that it's the relative hypoxia, or it's the hypoxia that might want to experience in a low oxygen environment chronically? Yeah,
good question. No, this is specifically an actual hypoxia.
That's what I thought. Yeah. So this is like you get the benefits of with hyperbaric, you get the benefits of hypoxia with none of the downsides, none of the sirtuin inhibition.
Not only not having the downsides, it's the total opposite, right? So in actual hypoxia, you get the VEGF, the stem cells, and the HIF1, but you lose sirtuins and mitochondrial function.
Right, right.
With intermittent hyperoxia, hypoxia, the way you would get through hyperbaric, you still get the VEGF, you still get the sirtuin, you still get the HIF1, you still get the stem cells. But not only do you not lose the sirtuins, you actually get an upregulation of sirtuin activity. And not only do you not lose the mitochondrial function, you actually get an upregulation of the mitochondrial function and even increased mitochondrial replication. In other words, your body will actually replicate mitochondria and will get an increase in mitochondrial density in the tissue to make sure that the body is using the oxygen as efficiently as possible. So exactly to your point, you get all of the benefit of hypoxia and all of the benefit of hyperoxia simultaneously. And so it seems to be.
And the third point is none of the downsides of the hypoxia that you would in a normal environment.
Exactly.
Yeah, which is like, that's just incredible. I didn't really understand until you explained it. So thank you. It's a really important distinction. The other thing I wasn't clear on was I knew that hyperbaric therapy was an oxidative therapy. It's an oxidative intervention, somewhat similar to ozone. Maybe we could talk about that in a little bit. But I wasn't sure how it did, and how it manifested that in your explanation of having the extra oxygen that was infused into the tissue slowly percolate out and being available as obviously an oxidative stress. I mean, there's no question. So with that in mind, most of the protocols I'm familiar with suggest that using a really selective, potent antioxidant approach is really great. And my favorite, of course, is molecular hydrogen, because once it's on board and you have it loaded like an hour or 2 hours before your intervention, that if indeed your body does perceive, your body, not your mind, but your body perceives an oxidative stress that requires some antioxidant intervention, it will make the antioxidants itself, like glutathione, SOD, catalase, all of these things that you may need. So what are your thoughts on using hydrogen, molecular hydrogen, or other antioxidant interventions?
So another great question. I'm going to go a little further into that first.
Sure.
So there was another great paper done by Dominic D'Agostino and Angela Poff, I think back in, it was either 17 or 18, looking at hyperbaric oxygen, but also specifically looking at the reactive oxygen species or the free radical component of, what are the benefits or consequences as we upregulate or as we increase the amount of oxygen into the body, as the cells and the mitochondria start to uptake that oxygen, producing more energy, there is a natural consequence, if you will, or this byproduct of free radicals being released as a part of normal cellular respiration. And I'll say that, I think in certain ways, while excess free radicals is obviously consequential to our cells, specifically, especially like cell membranes, lipid peroxidation and protein degradation, so it could destroy cell membranes, mitochondrial membranes, nuclear membranes, genetic material, so there are many consequences to all of this excess free radicals. At the same time, it's a normal response to cellular respiration, and our bodies have their own intrinsic mechanisms for dealing with some of this excess free radical. To your point, things like the superoxide dismutase, catalase, glutathione pathways. And so there seems to be a distinction that we should make. One is that some of the free radicals our bodies are exposed to come from the outside world in. In other words, radiation, smoking, air pollution, the list goes on and on. So we need to have a robust intrinsic ability to tolerate these free radicals with our own antioxidant system. But in excess, we could be getting too much free radicals, and we could be depleting our own systems, in which case supplementation should certainly be considered and used in a lot of those cases. Now, on the flip side, we look at hyperbaric oxygen as this tool that theoretically has all these great effects, but one of those consequences would also be considered this increase in free radical exposure. But there seems to be a very big delineation between a body that's exposed to free radicals from the outside world, from our environment, versus a body that is exposed to free radicals that it's creating on its own. And one of those distinctions to make is that through the use of hyperbaric oxygen, even without supplementation, through the use of hyperbaric oxygen exposure and the increase in free radical production from mitochondrial ATP production,
Mm-hmm.
the body itself, assuming it has the right raw materials, will actually increase its own superoxide dismutase, catalase, and glutathione pathways. So, which would, number one, it would help make you more resilient to the hyperbaric oxygen. But number two, would also help make you more resilient to all the other free radicals that we're potentially being exposed to, by our environment. And so I would say two things. One, especially with patients who are what I would consider a little bit more fragile when it comes to oxidative stress, those people I would tend to not over-oxidate to begin with. So I might start at a more gentle protocol with hyperbaric with them. And I'm likely to want to start quickly upregulating their own system, getting the right supplementation for improving their antioxidants, intrinsic antioxidant systems themselves, or even other like the seleniums and vitamin C's, like other extrinsic supplementation for antioxidant benefit. And then slowly improve as their system improves their tolerance for reactive oxygen species. We may not need as much of that. Or if we're going to be using high dose hyperbaric oxygen for a period of time, like you said, we might use things like, certain SOD precursors, or certainly molecular hydrogen has also, actually through conversations with you, have become, one of my most favorite also antioxidants that we use. And we'll do somewhere between, a 45 minute to an hour before exposures, and start loading people with the molecular hydrogen as a mechanism to reduce the consequences. But, there are benefits. In other words, reactive oxygen species on its own also helps stimulate hormone balance, helps stimulate, cell repair by themselves. So there's, like anything else, and I'm sure you would agree, there has to be this balance. We could over antioxidate somebody too, right? We don't want to quelch all the free radicals, because free radicals are a very important signaling molecule for so much cellular activity. And at the same time, we want to be aware of the fact that hyperbaric does increase that. And we want to make sure that we're not overexposing somebody either.
Yeah, no question. This is why molecular hydrogen is such a favorite of mine, because by itself, it is not an antioxidant. It does nothing to reduce oxidative stress independently. It's its byproduct reactions where it stimulates the NRF2 pathway and causes your own body to make its antioxidants if your sensors determine that it's needed. Because if it's not needed, nothing happens. So it seems it has a built-in fail-safe mechanism. And from your experience, because I'm not, this is only from academic intellectual perception, but I don't have any clinical interaction to confirm that. You seem to notice that as a benefit, where compared to someone who would take high dose vitamin C or combine it with glutathione directly, intravenous or sublingual, and which, is forcing the body to have this increase in antioxidant capacity that it may not need. Yeah, so it shut down the beneficial free radical signaling molecule pathways you talked about.
Yeah, there were. I would say there were earlier on, and not even that long ago, before I started using molecular hydrogen, I might have assumed somebody to be a little bit more sensitive to the antioxidant or to the oxidation than they were, and I could see that using, a more standard approach to actual antioxidants could have a negative effect, but even so could just prevent some of the benefits of what I'm trying to accomplish with the hyperbaric oxygen, could interfere with that. And they wouldn't get the full benefit of that system. Since using molecular hydrogen more as that mechanism, we haven't seen that, at all.
Good. So your clinical experience confirms that.
Yes.
It's good to know. So another interest I have is exercise. And it's one of the things that impressed me with you, because you're quite a physical specimen. There are very few people I've had to my house who are in as good a shape as you are. And I appreciate that, because, you're seeking to teach people how to be healthy. And if you aren't yourself, it's somewhat hypocritical. So you have a keen interest in personal fitness. So along that lines, we know that autophagy is a really profoundly useful and powerful longevity intervention. And one of the ways I personally seek to activate that is by fasting for a minimum of 16, and in the winter is sometimes 20, 22 hours before I eat my first meal, and exercise in that fasting phase, usually right before I eat, because that further depletes the glucose or the glycogen in your muscle tissue, which continues to even further increase the autophagy activation. But then I'm wondering, recently I've been doing that strategy and then following that before I eat. So I do the exercise and then go right from the exercise into the hyperbaric chamber. So I'm wondering what your thoughts are on that sequence and integrating the hyperbaric as part of an autophagy activation strategy.
That's really interesting. I don't get that one as often.
You don't hear me, people.
But I love it. And I did enjoy our workouts together. I'd love to do that again. It's not often I get such a big challenge on competitive pull-ups like you showed me. So, I would say a couple things. Some people use hyperbaric oxygen from like a performance standpoint, let's just say, while others are looking at it more from a recovery kind of standpoint. Now, I mentioned earlier that a lot of the mechanisms of hyperbaric are really anabolic for the audience, meaning rebuilding, regenerating, stimulation of growth, tissue growth, repair, et cetera, cellular repair. Whereas fasting is very catabolic. And the autophagy is, a particular purposeful breakdown of certain cellular components or cells on a whole, especially
not just certain ones, damaged ones.
Right, like underperforming and damaged cellular, right? Because if we can clear out the garbage, it helps to stimulate the likelihood of stem cells coming in to repair, recover, and regenerate the proper tissue types. So I love the idea. Number one, I think it takes time, obviously, for people to go through the process. Some people, as they start fasting or other things, they have dips in energy while their body's trying to deal with changes in fuel sources and the like. And so there might be a moment where people going through that, the exercise in a fasted state might take some time to get used to. But I think most people that we've worked with, I'm sure you have the same experience. Once you get through that process, exercising in the fasted state actually far exceeds your capacity to exercising in a fed state in many ways. I find that, especially for fuel and endurance and muscular endurance, especially. And I would absolutely agree that the exercise in the fasted state dramatically upregulates the effect of autophagy, as your body is required to find even a greater fuel source during this time where you're expending even greater energy. And so I think that that's a great combination to improve the process of autophagy, as well as the ability to create energy from, let's say from body fat and from, creating ketones and the like. That being said, you then want to go into this fed state. You want to clear out the garbage. You want to break down the sick, the dying, the dysfunctional cells. You're trying to clear out the garbage and then create space to bring in the new. And I think that that's where, hyperbaric would fit that model. And so, you're refeeding, so your first meal, I'm sure, is obviously very nourishing. It's probably relatively high in fats, and you're refueling the body to now start this. Okay, now we're getting fuel. Now we're going to recover, regenerate, and heal the tissue that we just broke down. And because oxygen, or hyperbaric oxygen specifically, is so stimulatory and anabolic in that capacity, I think you're literally, at the end of the day, all the food we eat, I'm simplifying life, but like the food we eat that we're going to use for energy all breaks down into NAD or FADH2. And then we combine that with oxygen to create, ATP, cellular energy. And so you're going to refuel properly with foods that are going to be, very energy dense with good quality fats. And then you're going to oxidize those fats with hyperbaric, with extra oxygen, right? And so as a synergistic effect to help refuel the cells to now upregulate their performance, hyperbaric oxygen would play such an amazing role in helping to improve the performance of that cell who's now being refed to function properly, to heal and regenerate.
All right. Well, I've got some questions on that, but I just want a clarification first, because I love the fact that you're getting a degree in molecular biology, because that literally is my favorite discipline. But it's my understanding that when we eat the foods, it doesn't break down to NAD or FAD. It breaks down to coenzyme A. structurally, the units of coenzyme, which are then converted with the assistance of NAD and FAD to ATP.
Right. Actually, that's why I said I was simplifying life a little bit.
Okay. All right. Yeah. But the interestingly, this aside before I get to my question, is that there's a lot of focus on using NAD as a supplement, primarily based out of Sinclair's work when he was at MIT and with Lenny Garanti's lab, that showed that the benefit of NAD is not primarily in this process in the cellular respiration, but as a sort of a catalyst for that, but as a support and actually fuel for a variety of different enzyme systems, of which sirtuins would be an important one, but certainly others. So if you don't have enough NAD, you could activate the sirtuins as much as you want, and they're just not going to work. So that becomes in how do you activate NAD? Well, many people now, including Sinclair himself, are really into these NAD precursors, and niacin being another precursor, NMN and NR, nicotinamide riboside. But I don't think, and I'm actually going to be speaking to a PhD from the UK, Mercola Dr. Condon, soon, actually next week, I think, or 2 weeks, that about this, because she's of the similar belief in that really that you can take the precursors, but they're not as good as actually the exercise, and specifically exercise in a fasted state when you just really are ripping it. I'm not talking about doing some yoga, I'm talking some really hardcore resistance training. And that will activate this enzyme called NAMPT, which is the rate limiting enzyme for NAD. And it just puts it through the roof, literally 10, 20, 30 times higher than you can possibly ever get with precursor supplementation.
Yeah. And, I think I don't know if you have, I've played around with quite a few of these different derivatives.
Oh yeah. I stopped them. I don't do it anymore. I just do the exercise.
I'm interested in, you know me. So like, I'm interested in, even just in my own life, just experimenting to see different variations and do I see any of those changes, and I think that I'm sure there's room for it. I'm sure there's a place for it. I would be surprised to find out that it doesn't do anything. At the same time, if all you did was NAD precursors or even NAD IVs, but you weren't doing the work on the diet and you weren't doing the work in the exercise, I don't know how much any of these things are going to change your story. In other words, the way I view it is that, our bodies have the capacity to do amazing, biochemical transformations based on the exposures that we give them. But I don't believe that there's any biochemistry that really can occur without the proper sequence of signaling. That is how we were designed to, to function. In other words, exercise would be an innate activity that we would put our bodies through this challenge. It goes back to that hormetic effect, right? I don't know that you can create enough hormesis with the single ingredient megadosed in your body without all of the cascade of events of signaling that are required to actually kick it into gear and tell your body what to do with it. Mm-hmm. That being said, I think if you probably had the right signaling and were doing the right exercises, and then you added some of those precursors, you could probably magnify the approach. But I think a lot of people also get stuck in trying to manipulate the biochemistry without actually doing the work required to stimulate the right.
Well, there's two confounding variables that interfere with the optimal analysis. And one is the fact that as you're younger, like someone like yourself, you have pretty high NAD levels intrinsically. It doesn't start decreasing until you hit the 50s, 60s, and 70s when it hits the dirt. I mean, talking 90, 95, 99% lower levels than we are at your age. So, it's not a clinical issue for the most part. And then secondly, and perhaps more importantly, is that it's almost impossible to commercially determine what your NAD levels are. This is a research lab only test. You can't go to any lab or mail order company and expect to get an accurate NAD test. It's not going to work. It's highly perishable, incredibly difficult to analyze biomolecule. So that's part of the problem. And if we can measure our NAD levels, if we could, a blood glucose, this would be a non-issue. We would know the answer a long time ago. But right now, we just have to rely on sort of speculative science.
Right.
So anyway, getting back to the fueling sequence with hyperbaric, I understand that hyperbaric is an anabolic response, but do you think it's better to go in there in a fed state just right after a meal, which is a bit of a problem because obviously you got pressure and you can put, especially in your chamber at 3 or 4 atmospheres, you got a lot of pressure on your epigastric area. So, and it becomes uncomfortable, but I'm wondering, do you think it's better to be fasted and then eat right after or eat right before?
So I'll still focus on the fact that I think that the majority of the benefits or effects of hyperbaric happen to be in the anabolic approach. But I will also say that there's a few studies that look at hyperbaric and autophagy. And I think that part of that has to do, that's like not something that's been explored anywhere near enough, but, potentially some of this upregulation of reactive oxygen species and the body's ability to just start kind of either kicking cells into, from senescence back into active life, or deciding that, okay, I've tried to upregulate this cell, I can't, so we're going to, go to apoptosis and kill it. There does seem to be this side benefit of even potentially increasing autophagy with hyperbarics because of that function.
There are some studies that support that. I thought it might. I didn't know that.
Yeah. But I think that because also the benefits of hyperbaric are for hours, even after your session. Mm-hmm. Again, I know you don't love the analogy, but I still look at oxygen as a nutrient of some type. Mm-hmm. I look at that as you're refueling your oxygen, and then you're going to eat shortly after that session anyway. To me, that's still within that same
frame. Okay. It's kind of like eating protein after you work out. You don't have to do it like 3 minutes after you finish your workout. You can do it within hours. So, but you got to do it,
exactly right.
At some point close to
close enough. Exactly.
Yeah. Well, that helps a lot. Thank you for expanding on that. So, those were the burning questions I had. So I guess, so since we've last spoken, what are some of the exciting, we went over some of the basics, but what are some of the exciting new areas that you uncovered or learned recently?
There's been a few things that I think that we've done just for the profession that have been really meaningful. One of which is, I've taken over the years just to learn more for myself. I've taken numerous courses in hyperbaric medicine, trying to learn from those who know as much about the topic as anyone else. Particularly, there's a gentleman, Dick Rutowski, down in Key Largo. He's 93, I believe, and he teaches 40-hour hyperbaric course. And I'm sure he's forgotten more about hyperbaric than potentially I'll ever know. I look to these people to learn as much as we can to help continue furthering the field. And at the same time, there are so many people interested in applying hyperbaric oxygen for the things that you and I are talking about today. And there's virtually been no mechanism for practitioners to learn what I would consider to be more of like a functional medicine approach to hyperbaric. Mm-hmm. And so over the last, probably about a year and a half ago, I started writing, curriculum, similar curriculum that you would expect in any intro to hyperbaric course, in terms of, there's no difference between the science is the science, the mechanisms of action, or the mechanisms, the history is the history. The difference becomes how we apply the tool to different conditions or for different people in different ways. And so, I put together a curriculum that I would have considered to be, basically the functional medicine hyperbaric curriculum. And I went to a particular organization, the International Board of Undersea Medicine. There's a gentleman, Dr. Joe Dottori, who runs that organization, and they certify, diving medic technicians. They certify medical doctors in hyperbaric medicine. They've been certifying people in hyperbaric medicine for 25 years. That organization was actually started by Dick Rutowski, back in the mid 90s, I believe. And so basically, he, Joe Dottori and I really came together, and between the materials that he had and the materials that I was writing, and we formulated this functional medicine hyperbaric clinician course, and we've been teaching it now for the last year. And really, the goal here is because hyperbaric, unfortunately, even with all the work that I've been doing and that you've helped with, and so many other contributors, for patients to access hyperbaric medicine right now is still very, very difficult. There are nowhere near enough clinics or competent practitioners, applying this the way that it needs to be applied. And so, a big push for me, and even for the research that I'm doing, is just to help create that awareness that gets more doctors excited about it, that want to actually use it in their practice. And so this has been an attempt to really improve the education so that people aren't just going to hyperbaric courses to learn about wound care. While that, I think that that's still critically important, and it's, for folks who are practicing in that way, a necessary tool. We needed courses to help practitioners like myself or other people interested in the regenerative side to be able to learn how to apply it that way. And so we now have a mechanism for that. There is a course that now exists that I teach a few times a year to actually get people on the same page. That was, I'd say the majority of this last year, other than, getting through school and writing the thesis, has been on, developing that course and really promoting that course. And we've, I think we've certified about 125, 150, practitioners and technicians specifically on the functional medicine side of hyperbaric use.
Terrific. So what are most of these clinicians using chamber-wise? Is the soft shells or the hards?
So it's a mix. A lot of, more and more people are, some docs they're just nervous, still getting into it. It seems so foreign. So that's a big part of what we're trying to do. And, the mission of the International Board of Undersea Medicine is just to simplify hyperbarics, because I think a lot of doctors are still, there's so many myths, there's still so many misconceptions around hyperbaric medicine that, doctors are nervous to really implement it. So in trying to simplify it, trying to make it easy, but still respect, obviously, the nature of the field, I think more and more people are open to utilizing the therapy. I think a lot of home use is still almost all soft chamber. Mm-hmm. And in the clinics, we're seeing a pretty good mix of soft chamber and hard chamber. And I think that we're seeing that the hard chamber can grow in a way that's very safe, that's very effective, and that helps the clinicians feel good about what they're offering while keeping the patient safe, but also improving the percentage of effectiveness that they can have while doing that. But at this time, I still see a pretty big mix between soft chamber use and hard chamber use in those. And a lot of those doctors are either, DOs or MDs or chiropractors or naturopaths. And, they're either getting into more of a functional medicine base in the first place, just looking for other natural approaches to the same things that they were treating. And I think hyperbaric just becomes like a natural interest of, supplying the body with a fundamental ingredient that's so necessary for cellular performance. It just seems to make sense to start implementing a tool and a modality like that into a setting where you're trying to help, overall reduce inflammation. That's a chronic issue across, industrialized nations. You're trying to just improve energy production cellularly. So, it becomes a natural interest for a lot of these doctors to include it in their practice.
Before we go into this question, why don't we expand on the potential indications where someone might be interested in using hyperbaric as an intervention? Like in my mind, it would be stroke. I mean, that's like the first thing that comes to your mind as soon as you hear that they haven't get them out of there. They go straight to the chamber. Would be a traumatic brain injury would be another big one. Even post-MI, anytime where there's post-ischemic reperfusion injury. So, but why don't you give us your list, because it's more comprehensive?
Yeah, so I think the list of potential uses for hyperbaric, I think, is a very long list. What I would say is that in the U.S., according to the FDA, we have 14 indications that we use hyperbaric for.
These are ones that insurance will pay for.
Correct. Yeah. And again, that's things like radiation burns, osteonecrosis, osteomyelitis, gangrene, certain diabetic neuropathies, and non-healing wounds. The list of potential uses of hyperbaric outside of that list, I mean, there's roughly over 100 what's considered to be internationally recognized indications, and some of that gives it bad press, like as if hyperbaric was a cure-all. Mm-hmm. And what I would say to that is it's not at all. In fact, I don't believe that hyperbaric by itself really cures anything. All it really is providing the body with a foundational, again, nutrient, if you will, or molecule that virtually almost all the cells in our body requires to function. And we're just giving it in surplus, creating an excess reservoir of oxygen, to improve that function. So, who can benefit from that? I think the list is very long, but let's talk about it has an amazing role in neurologic issues and or neurodegenerative issues. For all the same reasons, whether it's reducing inflammation, there's literally neurogenesis through brain-derived growth factors, so BDNF release. There's a lot of nerve and brain potential for regeneration. We know that we can get an increase in mesenchymal stem cells, but we also know that we can get an increase in central nervous system stem cells as a result of proper hyperbaric utilization. So between its rebuilding of nerves and brain tissue, its increase in central nervous system stem cell activation, the reduction in inflammation, the rebuilding of the microcirculation around nerve, right? So nerves and brain, the brain is 2% of our body mass, uses up over 20% of our oxygen. We know how metabolically active the brain is. And so any type of neurodegenerative or traumatic brain issue, be it concussion or other TBI, or even post-stroke, having that excess reservoir of oxygen to help promote the healing literally as soon as humanly possible, that seems to have an amazing effect for so many of those neurologic, neuropathy, post-stroke, and neurodegenerative conditions. An entire other category of potential improvement would be within the majority of autoimmune conditions. Similarly, for the inflammatory reduction, for the balancing of cytokines, for the stem cell activation, for the healing, for the collagen regeneration and the fibroblasts, the soft tissue regeneration. So just to help reduce the consequences of the inflammation, and then again to regenerate the tissue around it. Most autoimmune, be it from MS through potentially lupus, through RA, MS, so many different autoimmune conditions that would respond favorably to hyperbaric. Any type of blood, either blood loss or potential ischemia. So whether that's, again, back to the ischemic stroke or potentially, an MI where you're having an ischemic, heart issue. But in order to lessen the reperfusion injury, but also to help promote the healing and the reoxygenation of the tissue to help repair and regenerate after an event like that, again, the quicker we can get to it, the more impact we can have. Any type of ischemia situation would improve, includes things like even birth trauma or with CP, all similar in potentially in that vein.
CP being cerebral palsy for those.
Correct. Yes. And so a whole other category of potential use would be, what I would consider to even be either wellness or longevity or regenerative type therapies. We're all exposed, at the end of the day, we're all exposed to traumas throughout our life. We're all exposed to toxicity throughout our life. We're all exposed to, injuries that didn't heal properly or surgeries that never healed properly. As a way to have an ongoing therapy in our life that helps to continue to promote a reduction in inflammation, an increase in growth, repair, and regeneration of tissue, a rebuilding of the microcirculation for gas exchange so that we can deliver oxygen to the cells in need, all the same mechanisms that we would talk about, the very severe conditions that are traditionally, insurance reimbursable, all the way through chronic illness, plaguing, so many of us or our family or loved ones in the US and other industrialized nations, all the way through sort of this, wellness, recovery, and regenerative type therapy. The mechanisms are all the same. We're just applying the tools slightly differently to help match the intensity of the therapy to the severity of the condition. And we can utilize the principles of gas exchange in various ways to help so many different types and varied types of conditions. One condition or subclass that I left out that we should talk about, we talked about it in the beginning, is again, from the immune system standpoint. So whether that's upregulating your ability to fight infection through increasing white blood cell activation through the reactive oxygen species mechanisms, or we use it for anaerobic infection, bacterial infections all the time, even traditionally gangrene or necrotizing fasciitis. I mean, one of the main reasons that hyperbaric works in those severe conditions is those bacteria are anaerobic. They don't live in high oxygen environments. So we know that putting a patient in a high oxygen environment massively decreases that bacteria's ability to function, potentially helps to kill that infection, helps to block the toxicity of that infection, helps to break down the biofilms around that infection. And so, hyperbaric becomes an amazing tool in the capacity of immune system balancing and or ability to help fight infection.
And along those lines, other cells that don't respond favorably to excess oxygen would be many types of cancers. So especially if you're in the process of treating them with metabolic therapy interventions like Dr. Thomas Seyfried of Boston College advocates. So, and Dominic D'Agostino has done a lot of work in that area too. So in the use of hyperbaric intervention as a synergistic strategy.
Yeah, absolutely.
For many cancers. So, all right. So big question is a lot of good reasons to use it. So I'm wondering, how frequently do you use hyperbaric?
That is a question I get a lot. So I would say that I basically do about 2 hours a week on a regular basis. Mm-hmm. I travel a lot, as you know. Mm-hmm. I'm lucky because most of the traveling that I do revolves around hyperbaric, which means there's usually a chamber wherever I'm going. So I like to utilize hyperbaric with travel quite a bit, whether it's while I'm traveling or certainly when I come home. So when I'm traveling, I might use it a little bit more than that. But my typical routine is roughly 2 hours a week. And then 3 times a year, I create a 30 to 40 hour protocol.
Wow, did not know that.
Over like a 6 or 8 week period. And so, I sort of have gotten into a rhythm now of when that is in my life. But 3 times a year, I go through a pretty significant protocol, similar to what I would use, when initiating a treatment protocol for a patient. Mm-hmm. And all the other times in that year, it's usually about 2 hours a week.
Interesting. So what is the logic behind that 3 times a year intervention? It's more than once a quarter. Actually, it's a little bit less than once a quarter.
It's a little less than that.
Yeah. So it's really curious and surprises me. So I'm sure there's good reasons for it.
Well, I haven't done the research on it yet, but maybe I will. My understanding is based on this. We know that in general, a session or two, any session could be helpful, but for the real reasons that people do hyperbaric, 1 or 2 sessions, 3 or 4 sessions, it's not going to ever cut it. Mm-hmm. The main effect of hyperbaric is really achieved through the cumulative effect and the increasing and decreasing the wave of hyperoxygenation back to normal oxygen levels. But, creating that, as we talked about, the Hypoxia-hyperoxia type paradox. And so anytime you go in a chamber and out, even let's just say I did Monday, Thursday as my routine, you would still have some amount of that wave. But that wave, the space in between those waves would be pretty big. When you do a protocol similar to like what I would do for a patient, so let's just say, 4 to 6 hours a week for 8 weeks, the frequency of those lines up and down of hyperoxia-hypoxia are way, the space in between them really shrinks and you get far more signaling to occur. And I do believe that, while I often lecture and I say about half of the treatment is the time in the chamber and about half of the treatment is when you get out, my real belief at this time, based on the research that I've been reading about, I would probably even say maybe 75% of the treatment is actually getting out. Mm-hmm. And so the amount of frequency that you can create that hypoxia-hyperoxia, I think makes a big difference. And so to create those lump sums periodically throughout the year, a lot of the things that we were looking for, the stem cells, the the growth factors, the BDNFs, the PDNFs, the microcirculation rebuilding, the immune system activation, we know that this, 20 to 40 hour window is really where a lot of that occurs. Mm-hmm. We don't have the research to support the idea that 2 hours a week over the course of a year would get the same response as 6 hours or 5 hours a week over the course of a month. And so until I have the research to support that, I still think putting these very particularly, spaced protocols throughout the course of the year really helps me maximize the benefits that I'm looking for with regard to it.
It potentially could be overkill though, because it seems like at some point you're going to reach an asymptote or equilibrium where you've reached the most benefit you could possibly reach. And I would have thought if anyone could reach it, would be you, because I don't know anyone personally who does more hyperbaric treatments. So anyway, that's something to explore. I'll definitely have to cogitate on and reconsider that, because I've got a chamber and I do it only an hour a week, primarily because of time restrictions, but an hour a week. But the chamber I have is one of the few in the world, and you know which chamber that is, that actually changes the pressure midway through the treatment. So you get this drop in treatment. So you mentioned your body can't sense pressure, but it's just like it really can't sense acceleration once you've achieved a static speed. So when you're depressurizing or pressurizing, you're going to sense that big time, and no question. Yeah. But once you're at pressure, you really don't notice it unless you've got some problems with your ears. Right. So anyway, the difference is that halfway through my treatment, drops down. I usually get treated about 3 atmospheres, and then I drop down to like 2.2 or 2.1 for the rest of the treatment. I mean, it just seems like that there's a relative hypoxia during that drop. So you definitely, rather than the 1 hour treatment, it might be equivalent to a 2 hour treatment because of that.
Yeah, I think that two of the things that we're working with in our clinic, and we support a whole bunch of clinics around the country. We talk about creating a wave of pressure throughout the course of a session, and also creating a wave of oxygen. So we'll have people. We used to take, in certain conditions, you're taking air breaks, where you go from 100% oxygen to 21% oxygen on purpose. The reason that was initially instituted was really because it helps decrease the likelihood of oxygen toxicity. However, there seems to be a therapeutic effect. And so not only will we create a wave during the session of pressure, we'll create a wave of what percentage of oxygen somebody's breathing in that time. Again, because I think more of it has to do with the cell signaling that occurs than the physical dose. If all we cared about was the physical dose, we would stay at 100% oxygen as long as we possibly could at the highest pressure we could tolerate to get the most oxygen absorption. I don't think that that's where the majority of benefit exists. I think the majority of benefit exists by, every time your pressure changes or your percentage of oxygen changes, which is really both changing the pressure of oxygen, you're stimulating HIF-1 alpha. You're changing the reactive oxygen species load. You're signaling those sirtuins. You're signaling, a hormetic effect. And so every time you get those changes in pressure or the changes in percentage of oxygen, you're improving the rate of, I picture them as switches, every time you change them, you're flipping that switch on, off, on, off, on, off. And I think it's the amount of times that you stimulate that switch that's going to create the benefits that we're looking for, more than the physical dose of oxygen over time.
Yeah, intriguing. So we've given people a lot of resources. Now, one of the most important ones, if someone has been really catalyzed to seriously consider implementing this in their own personal protocol or for a relative, how does someone go about finding someone? Because one of the complications, as you had mentioned earlier, there's 14 indications that are covered for by insurance. And unfortunately, most of the hospital chambers will refuse to treat anyone unless they have one of those indications. So those centers are out. You have to find a private one. So why don't you go through the challenges and the resources that people would, the hurdles that people have to overcome to find a center or a treatment center?
Yeah. So like you said, it isn't the easiest thing to find. And usually if you do a typical search online, the wound care clinic near you and the hospital near you, they're going to show first. And the unfortunate thing, like you said, is, those phone calls are often dead ends. And it's not that the technicians there or even the doctors there wouldn't want to treat them per se, but you can't have, dual fee schedules. And so you can't charge an insurance company, $2,000 to $3,000 an hour and then charge a patient $200 to $300 an hour. And so you in general, these clinics just tend to not treat off-label conditions, period. Mm-hmm. What I will say is, taking a look at their websites can give you some pretty good insight into like what types of things that they're looking at and what types of things that they're treating. Like I said, we did initiate this certification course. So, a lot of the clinics that we've certified so far, we've posted. And so our main website is hbotusa.com. And we have a locations tab there. So not all of them, but many of the centers that we've trained and certified those folks and their clinics are listed on that for people to find clinics that would function similarly to the way that, I would function in the clinics that we own on the East Coast. And so that could be a good way to find some people. Otherwise it's like you said, it's an online search, and it's digging through a little bit just to see that, a center that focuses on, TBI and concussion, a center that might focus on neurologic repair and recovery, or a center that is a more functional medicine based center. Those are going to be more likely the places that are going to consider treating people for all the different things that you and I have talked about today.
Yeah, and the treatment dose or course or regimen should be about 30 to 40 treatments. And what should the average center, I know there's a range. What do you think the typical range is going to be around, so people can have an idea what to expect? Yeah,
I think the national average is probably around 175 an hour. There's definitely places that are closer to like 500. There's a few places around the country that are closer to even 80 or 90. But I think the national average is probably pretty close to around 175 a session, especially if you're buying them in, packages is the way it's usually done. 10 sessions, 20 sessions, 40 sessions at a time, trying to make it a little bit more affordable for people to have access to that.
Okay, good. And then you've written a book. We've done a previous interview with that. What was the name of your book? And we can put a link to that.
The name of the book is Oxygen Under Pressure. Also, it's still available on Amazon too. And then HBOT USA is our main website. We do still have a YouTube channel for now.
No, I don't think they're going to take you out. You've provided a lot of great information, Jason. I look forward to connecting with you in person at some time in the near future, and keep up the great work.
Thank you, man. You too.
All right.
We appreciate you more than you know.